they check the interocular pressure. And people often do not notice that they have any signs until there is significant vision loss. And there are many treatments for glaucoma. One of the more important ones is that people are given eye drops often, and often need to really remain diligent and compliant in using their eye drops so that they can lower the pressure, their interocular pressure. So the risk factors for glaucoma include the high interocular pressure, aging, heredity, if you have a family history of glaucoma, race, and people who are African American or Hispanic have an increased risk, about 4 to 5 times more likely to get glaucoma. And then the central cornea thinness, and it is more common in males. So glaucoma is often treated with eye drops, as I said before, or surgery. It is important that the patient is followed up and that their drops are given on a regular basis. If you find that patients have problems affording their eye drops, or if they find that they burn, that's really something for them to discuss with the provider, because there are sometimes alternatives that could be less expensive or that could not burn as much. Okay, next polling question. Diabetic retinopathy harms the central vision, the optic nerve, blood vessels in your retina, or clogging of the lens. Whoa, everybody is doing really great with this one. So diabetic retinopathy can destroy the blood vessels in your lens. In your retina. I feel I can't do two things at once. I apologize. So 40% of people with diabetes will get diabetic retinopathy. It's the leading cause of adult blindness, and it causes changes in the blood vessels, as we said before. It weakens the small blood vessels, and they can break down or leak or become blocked, and abnormal new blood vessels grow. And you see in the bottom picture, it creates kind of these spots in people's vision. And really, research has shown that in Ohio, that cases of diabetic retinopathy have increased 31% from 2000 to 2012. And these numbers can only be expected to increase as the incidence of diabetes increases. And complications can include age, blood sugar control, smoking, alcohol use, hypertension, and the duration of the disease. So after 20 years of diabetes, nearly all patients with type 1 diabetes and 60% of patients with type 2 diabetes have some degree of retinopathy, which is a growing issue as more children are being diagnosed with diabetes. Consider the ramifications of what this means for a child of 10 who is diagnosed, and then by 30, their prime age for working and providing for themselves and their families is they're now dealing with a diabetic eye disease. So, so we just happen to be in the month of November, which is Diabetes Awareness Month, and more than 29 million Americans have diabetes, and it's considered a chronic disease, obviously. Diabetes affects or increases the incidence of cataract, glaucoma, diabetic retinopathy, and diabetic edema. So people who have diabetes really need to work to control their blood sugar levels, their diet, need to exercise, and people with diabetes need to have a dilated eye exam annually or more frequently as recommended by their eye care professional. So, thank you. Next.
And that brings us to our next polling question, which is 1 in 20 preschoolers and 1 in how many school-age children has a vision problem? I'll let you submit your answers and introduce myself. My name is Darcy Downie, and I am the Northeast and Northwest Ohio Chapter Director. And we're kind of split on this answer here. Okay, well, the correct answer is 1 in 4 school-age children has a vision problem. So we have 1 in 20 preschoolers with a vision problem, and 1 in 4 school-age children have a vision problem. 25% of school-age children have a vision problem. Approximately 80% of learning is visual for the children. This affects all areas of their learning and their physical development. Children's vision problems may be picked up at a screening by the school or in the pediatric office during an exam. And sometimes children don't know that they have trouble seeing. Not only are parents and caregivers often unaware that their child has a vision problem, but children are most often unaware too. They only know one way of seeing the world, and they don't know that there's a different or better way for them to see it. The visual system is still developing in young children, and the pathways from the optic nerve to the brain are fully developed somewhere between the ages of 6 and 8 years old in the child. That age may vary depending on which study you read. Children should enter school 100% ready to learn, and early detection and treatment of possible vision problems is an essential component of school readiness. The importance of early detection. Not only are parents and caregivers often unaware that their children has a vision problem, but again, children are unaware too. They only know one way. The prevalence of vision problems are on your screen. 5 to 10% of preschool-age children do have a vision problem. 25% or 1/4 of school-age children do have a vision problem. And 79% of school-age children have not visited an eye care professional in the last year. Some of the common to all refractive errors is that it can be corrected with glasses and are hereditary in nature. Now, the refractive errors are myopia, which is commonly known as nearsightedness, and the near objects can be seen clearly, but distant objects are blurry. We have hyperopia, which is commonly known as farsightedness, where the distant objects can be seen clearly, but the near objects are blurry. We also have strabismus, and this refers to the eyes that are not straight or properly aligned. You may see one or both eyes drift like in towards the nose, out, or up and down, and this affects the depth perception and also can cause amblyopia, which is the next disease that you see on the screen. Amblyopia is often called lazy eye and is defined as a loss of vision in one or both eyes due to the lack of use by the brain. Amblyopia is not something that can be seen by adults just by looking at your child's eyes. If a condition exists that causes a difference in the vision between the eyes, the brain will begin to favor the vision in the good eye. And these conditions can include unequal refractive error or strabismus. The development of vision in the bad eye For example, the pathways from the optic nerve to the brain will be slowed or stopped. And remember that 6 to 8 years old is the threshold for diagnosis. If not caught and treated early, amblyopia can lead to permanent vision loss in the child. What can you do? Be aware of the ABCs of observation, the appearance, the behavior, or the complaints of the child. Consider becoming a children's vision screener. Know the eye care professionals in your area who see children. Not all eye care professionals will see a child, and understand the vision resources available to you for children. Let's go on to appearance. This is how the eyes appear upon the visual inspection when you're looking at the eyes of a child. Are the eyes red or are there swollen eyelids? Is there a drooping eyelid like the little boy down at the bottom of the screen to the left? Is there a growth on the eyelid or the eye? Is there crustiness in the eyelashes? Do the eyes cross? And is there cloudiness in the cornea? Behavior, that's signs in the child's manners, stance, or vision. Is the child holding their materials too very close? Are they holding a book like right up to their face or an iPad right up to their face? Do you see them squinting? Is there constantly tilting their head or face turned? Are they trying to cover one eye with their hand while they're reading, or are they standing very close to a television? Complaints. These are the signs that would indicate the discomfort or an illness. If a child or the parent is indicating any of the following. Is the child complaining about eye pain? Is the child complaining about itching or rubbing their eyes? Is there double or blurred vision? Or do they frequently have headaches? All of these would be a sign of a complaint. Becoming a children's vision screener. Your training and equipment are free. I encourage you to visit our Wise About Eyes website to register for a training in your area. And when you register and you go through the training, you will receive a 3-year certification and approximately $950 worth of equipment. Finding local eye doctors. There are some websites listed below where you can search for doctors in your area. And again, remember that not all eye care professionals can see a child. There's the website for the Ohio Optometric Society, the Ophthalmological Society, and the Ohio Department of Health. Again, a vision resource, Prevent Blindness is a one-stop shop for free and reduced vision care and glasses for children. Infant C is a program that is implemented through the American Optometric Association that does provide for a free vision assessment for children who are between the ages of 6 and 12 months, and you see infantc.org is listed below as far as their website. And your local Lions clubs, they can assist with recycling of any old glasses, and they can sometimes fund treatment for vision problems outside of the scope of an eye exam and glasses. And some can also provide vision screening services to your schools or your organizations. In 2014, what were the 3 top toys associated with the most estimated injuries for all children? Please select 3. Again, 3 top toys associated with most estimated injuries for all children. We'll give that a minute to populate because those are quite a few questions. A pretty varied group of answers here. Looks like BB guns are winning out. You got to watch out for those Barbie dolls, too. Okay, the top 3 toys that are associated with the most estimated injuries are, number 1, non-motorized scooters, toy balls, and toy vehicles. Going into December, December is Awareness Month. December is the Safe Toys and Gift Month. And as you can see, there's an estimated that hospital emergency rooms across the country treated over 250,000 toy-related injuries, compared to 265,000 the year before. 73% of those injuries were to children under the age of 15. In fact, approximately 84,000 were to those under 5 years of age. It is okay to make recommendations to family members and friends about gifts that you feel are appropriate for your child. Be diligent about inspecting these gifts before allowing your child to play with them. Inspect all the toys before purchasing, and monitor the toys that your child has received as gifts to make sure they're appropriate for your child's age and developmental level. Not all children should have any single toy that they want. There are some great fact sheets on our website. There is one about tips for choosing safe toys, where you should consider when buying toys for a 2-year-old and a 4-year-old. And we also have on the website facts about toy injuries. So I encourage you to do that and go to our website and print out some of those facts and share them in your organizations and your schools. Gifts or sports equipment should always be accompanied by protective gear. Again, read all warnings on the toys. Keep the toys that are intended for older children away from young children, and avoid any flying toys and projectiles with firing toys. And I would like to turn this back over to Kim for reason number 2.
Thank you, Darcy. So reason number 2 is we received a success story from a mother of Victoria. This child is age 5, and her mother wrote, "We saw that our daughter constantly hit herself with the walls, corners, when she walked or fell when she was running. Thanks to this program, we discovered that it was because of her low vision, and now she is able to have her glasses. And we wanted to improve her quality of life and her school development. Thank you so much." Okay, let's go on to the next polling question. And it is, a dilated eye exam is necessary only if you are having problems. Take a second to answer that question. And next we're going to have Karen Deberry, our Northeast, Northwest, and Children's Vision Coordinator, give a presentation. Karen?
Good afternoon. My name is Karen Deberry, and I am the Outreach Coordinator for Northeast, Northwest Ohio, and all children. So if you answered false to the last polling question, you've answered correctly. So why is a dilated eye exam so important? You may think your eyes are healthy, but visiting an eye care professional for a comprehensive dilated eye exam is the only way to really be sure. During the exam, each eye is closely inspected for signs of common vision problems and eye diseases, many of which have no early warning signs. Annual comprehensive dilated eye exams are generally recommended starting at age 60. However, for African Americans, they are advised to start having comprehensive dilated eye exams starting at age 40 because of their high risk of glaucoma. It is also especially important for people with diabetes to have a comprehensive dilated exam at least once a year. Dilation is an important part of a comprehensive eye exam because it enables your eye care professional to view the inside of your eye. Drops are placed in each eye to widen the pupil, which is the opening in the center of the iris. That's the colored part of your eye. Dilating the pupil allows more light to enter the eye in the same way that opening a door allows light into a dark room. Once the eye is dilated, Each eye is examined using a special magnifying lens that provides a clear view of important tissues at the back of the eye, including the retina, the macula, and the optic nerve. Prevent Blindness recommends that everyone receive a dilated comprehensive eye exam regularly as recommended by your eye doctor. Dilation may not always be a part of the eye exam, so be sure to ask your eye doctor for the dilated eye exam portion. All Prevent Blindness Ohio donated eye exams include a dilation. We have heard in that some clients say no to this part of the eye exam, so we ask that you partner agencies encourage all of your clients not to skip this part of the eye exam. And, well, you shouldn't either during your own eye exam. Now I would like to introduce my colleague, Clarice Williams, who is the Vision Care Coordinator for Southwest, Miami Valley, Franklin, and Fairfield Counties. Clarice?
Thank you, Karen. Now, I would like to do a quick refresher on some housekeeping points. When qualifying a client's income, if they are over the 200% poverty guideline, please do not submit the application. As stated on the slide, there are no exceptions. We must abide by this guideline. When submitting applications online, it's very important to select your name from the drop-down box. If you do not see your name, do not select someone else's name. Email or call us if your name is not listed in the drop-down box. We correspond to the person who submits the application, so if you are using a name other than yours, you will not receive correspondence, which could mean your client may miss a scheduled eye exam or questions that we may have regarding your client. Please do not send multiple applications on the online portal for the same person. When you submit your initial application, if you think you have made an error, or if you haven't heard from us in a while, or you have an update for the application, please email or call your Vision Care Coordinator. Now, right now, we are processing applications as quickly as possible. We have experienced a backlog due to staff turnover, but typically, once an application is submitted, it will be downloaded into the Prevent Blindness database within 7 to 10 days from when the application was submitted. If you want to view or print an application after it has been submitted, you have up to 14 days from the date to do so. When a client leaves the program prior to their eye exam, you may give them our contact information for them to contact us directly so that we can still help them with their vision needs. Now, just to let you know, we do have Spanish letters available. If you prefer this, just leave a note in the comments section of the application. And we want you to please continue to encourage your clients, both adults and especially children, to send us their success stories. Now, sharing their stories of success with our donors helps to keep our program in operation, and we can continue serving others in need. These stories can be faxed, emailed, or snail mailed to us. Now, to use our Vision Care Outreach Program services, clients must not have any insurance that has any vision benefits to them. There are several Medicaid plans that cover vision for adults and children. We know Medicaid covers an eye exam every 2 years for an adult and every year for children. Did you know? Now, when a client breaks or loses their glasses and their insurance won't replace the glasses, the client does not need a new eye exam. They just need replacement glasses. Have the client contact the eye doctor where they got their eye exam and get a copy of their prescription. Have the client contact you with the exact date of that eye exam, and an eyeglasses only application can be submitted on the client's behalf. Now, this chart you see here reflects the vision coverage with public funding in Ohio. I want to briefly touch on Medicare. We know that Medicare does not typically cover eye exam and glasses, but some cases it will. For example, those with diabetes must use their Medicare to receive a wellness eye exam. Medicare will cover 80% of the visit, and the client will have to cover the remaining 20%. We are always going to kick back the application when a client with Medicare has diabetes. Please let us know if you have any questions. Now I will turn this back over to you, Kim.
Thank you, Clarice, and also Karen, Darcy, and Laura. We now have a very special announcement to make. We are presenting our first ever Prevent Blindness Partner Agency Advocate Gold Star recipients. We chose these advocates because of their passion for what they do with PBO and what they do within their community. These 3 partner agency advocates have gone the extra mile for PBO on several occasions. Our star number 1 is Jen Menue from Holmes County Health District. We have been working with Jen since 2012. Jen says to us, I am honored that you have chosen me as one of the partners that goes above and beyond to serve the clients. In my spare time, I enjoy reading, watching the Cavaliers, spending time with my family and friends, traveling, going to Canada, and fishing. I enjoy reading the story of success forums and seeing how appreciative parents are for the program and how it has helped their child or children improve his or her vision. I truly enjoy helping people, and this program is just one of the ways I help our clients in Holmes and the surrounding counties. In fact, we received a success story from 2 children, Leah and Rachel from Holmes County, and the story was Leah examined her eyes and needed glasses. We paid for the glasses ourselves. The exam was free. Thank you. Rachel had glasses and needed to be rechecked. She didn't need new glasses because she had a growth on her left eye that needed to be removed. Her appointment was with a specialist today. He says it needs to be surgically removed. Her exam was in Berlin and was paid for by Sight for Students. Thank you so much, Jen, for being there when we needed you most. Congratulations, Jen. We really do appreciate you. Our star number 2 is Naja Melhem from East End Community Services in Dayton, Ohio. We have been a partner with East End Community Services since 2005, and we've been working with Naja since 2015. When Naja had big shoes to fill when her predecessor Alejandra left the agency, but Naja said no problem. She stepped right in and didn't miss a beat. Naja says she loves spending time with her family, cooking, and sitting around just talking to her kids, brothers, and sister. She loves the outdoors, nature, and gardening. She loves the ocean. She loves the summer and spring, but not so much winter. Naja says, I get great satisfaction of doing the job that I do, and that is helping our clients. I love seeing them smile. In fact, Linda wrote us a story, and she says, I am a disabled person and on a fixed income. My old glasses broke, and I've been using dollar store glasses to see. It's been very hard because my eyesight has changed. I am so thankful and blessed for Naja at the East End Community Services for the opportunity to get a new pair of glasses. I can see. Thank you so much. Thank you, Naja. And then star number 3 is Vicki Kokensparger from the Zanesville-Muskingum County Health Department. We have been working with Vicki since 2014. Vicki is the nursing administrative assistant, and she's also in charge of the Prevent Blindness program as the site coordinator. Vicki has been working with the health department for 13 years and coordinating the Prevent Blindness program for 7 years. She is married to her husband of 40 years, Craig. Vicki is the mother of 2 grown children, Adam and Cheyenne. She also has a new bloodhound puppy, Marley, who is 5 months old and is very active, and Henri. Vicki also enjoys photography and traveling to the mountains. Vicki is very passionate about helping people with the VSP and the Mobilize and Sight for Students programs, and she loves seeing how appreciative they are. Thank you so much, Vicki. Each of these advocates have we're gifting them a 25 gift card to Amazon, and we can't thank you, all 3 of you, enough for all that you do for our clients and, of course, the community you serve. And then, of course, we want to thank all of you as well. Because without you, we can't do what we need to do. So now I want to go to reason number 4,179, and again, I want to thank all of you, and because we count what we call an eye saved. And that's every time an individual is in need of, or we confirm that they've completed a full cycle of care. And that's from the point of the referral made by our partner agencies until we confirm that they've had it done. And we cannot do that without you, our partner agencies. You all play a critical role in the achievement of our goals to reduce the incidence of preventable vision loss for underserved and low-income populations by getting them to the eye doctor and providing necessary vision care. Thanks to the fantastic staff and our volunteers at all of our 1,699 partner agencies statewide, we provided 4,179 children, adults, and seniors with donated eye exams and glasses. And here's a story from a child. She's age 11, and she says, "Hi, my name is Anu, and this is my story about how getting glasses helped me see everything better. First, I could not see a lot of things on the blackboard, but then when I went to the eye doctor's office, they showed me different lenses, and it changed my eyes so I could see things up close. When I got my glasses, I was excited to put them on. When I put them on, I could see everything clear and bold. Thank you for giving me the chance to get glasses and to see much better." Also, I have a story that was served by Vicki at the Muskingum County Health Department, and this person says, "I am disabled as a master artisan and get just enough Social Security to keep me from being eligible for extra benefits like Medicaid, food stamps, etc. I have worked hard all my life making a good income and supporting my family. Now disabled with Medicare, I don't have any eye care. It has been since 2008 since my last eye exam. I love to read, but my eyes wear out after a short time because my eyesight has deteriorated. If not for this wonderful program for us who work so hard but now live on a fixed income, I would still be struggling with reading. You truly have been a blessing and have given me an eye exam and glasses. Vicki at the Health Department, Muskingum County, was so sweet and helpful. I didn't feel like a needy person, but a valuable member to society. Thank you again." And that person, she said she hadn't been since 2008. This is from this year. She used us this year and got her eye exam and glasses. So we are so glad that we could help her out and help her get her glasses. Okay. Now we want to open it up. If anybody has any questions, now you can address them in that chat box in the lower left-hand corner. Nothing's really come through that during our webinar here, so nothing to address overall. You are always certainly welcome to email any of us anytime if you ever have any questions. And we're always here. We're always there to you, to serve you and help you and make sure that you get everything that you need to serve your clients. Okay. I'm going to move on. I don't see any questions coming through. If we do, I'll bring it up. I do have one more polling question for the day. And the question is, what Prevent Blindness related topics would you like us to present in future webinars? So if you could take just a minute to type in the box and give us idea. And as a matter of fact, the feedback that we received last year was very helpful, and we did incorporate some of those suggestions in this year's webinar. So your opinion, your feedback is very important to us, especially since we put this on every year. We put this on for you, and we want to make it worth your time to attend our webinar. So I'll give you just a couple of seconds here to answer your feedback. And someone said they enjoyed the training, so I'm really glad, because that's very important to us that you enjoy it. And also, too, since sorry about the technical difficulties earlier, but we got it all fixed out and we all got it worked out, so we're doing good now. So thank you for your patience during that little snafu. Okay. I'm going to probably move on here. You will get another message when you log off that has a place where you can type in suggestions. So if you don't get a chance to type any feedback on this particular polling question, you'll have time to do that once you exit the webinar. So now, again, thank you for your valuable feedback. So now I want to announce the winner of our $15 Amazon gift card. We have two winners. You will be emailed the gift card. Jeannie Bunch and Leslie Coles is the winner of our gift card. So be looking for that by email. And with that, that concludes our webinar for today. We appreciate all that you do for us and the many other services you provide to your clients and to your community. We will stay on a few minutes if anyone wants to send us any additional questions or any comments. Again, thank you very much, and goodbye. Have a great day.